This is the Rift Valley Fever Livestock Abortion Surveillance Study that was done in Isingiro District. Funding for this study was from University of Cambridge, UK, under the following grants: Biotechnology and Biological Sciences Research Council, funded for field data collection and analysis. Public Engagement Fund enabled the filming and profiling of this field work. The Department of Veterinary Medicine field funds helped in implementation of training of health workers intervention. The Nigeria Travel Grant helped the PhD student to participate in other Rift Valley fever outbreaks in the country to enhance his field expertise. We would like to acknowledge the following institutions: Isingiro District Local Government for hosting the study, Ministry of Agriculture, Animal Industry and Fisheries, Eco Health Research Group, Conservation and Ecosystem Health Alliance, Kampala, Uganda. Thanks for making this study a success. This study was approved by Makerere University School of Public Health Institutional Review Board, Uganda National Council for Science and Technology, University of Cambridge Human Biology Research and Ethics Committee. The principal investigator for this study is Dr. Andrew James Conlon, who is an Associate Professor of Epidemiology at the Department of Veterinary Medicine, University of Cambridge, UK. The study coordinator for this study is Abe Wilson Walekwa. This study was filmed by the Irene Train. The overall objective of this study is to improve the prediction of risk of Rift Valley fever outbreaks across Uganda through integration of data on livestock movements and improved surveillance. Administrative clearance was got from the Office of the Chief Administrative Officer.
My name is Abel Wilson Walekwa, and I'm a PhD student at University of Cambridge in the UK. I am registered in the Department of Veterinary Medicine, Diseases Dynamics Unit. I am doing my PhD with Dr. Andrew Conlon. So this work that we are doing in Isingiro District, it is about Rift Valley fever surveillance, and we are focusing more on the animal side, on the surveillance system within the animal side. We were able to get a project which is funded through the BBRSC grant, through the Impact Acceleration Award grant for 2022. And so the principal investigator for this project is the Associate Professor Andrew James Conlon, who is my supervisor as well. This project was aimed at supporting me in my field work to collect field data that would support me in building my PhD work. So in this particular project, we have two objectives that we want to understand. The first objective is we want to understand whether it is possible for us to have community level tracking of livestock abortions in various livestock species within Isingiro District. And so we are going to work with the district leadership, specifically with the district veterinary officer. And we are lucky because he has designated for us one staff who is called Charles Were. So we are going to be working with him to see whether we can keep track of the livestock abortions that are going to happen within Isingiro District. We hope this project will run for around 3 months. That is from March, April and May 2023. And so we have already got IRB approvals and we have done administrative clearance at the district, and here we are ready to get started. Very interesting to note is that we plan to set up a call center at the district. We plan to have a telephone number, and specifically we are going to develop a flyer. Actually, we have developed a flyer already, and we have put the two telephone numbers, the one for the district veterinary officer and also the one for the project support team, who is Mr. Were Charles. The interest was that we wanted the farmers in various communities to have these telephone numbers because they could continue calling them about first livestock abortions which are occurring at their farms, but also other animal health related issues as well. And so we have set up a call center at the district, and so this call center is going to be managed by myself, who is a study coordinator for this particular work, and we want to see how the reporting will go on. What we plan to do is that after farmers call us at the call center, we will constitute a team that will go to the farms and then do some investigation at the farm level. Actually, part of the investigation, we are going to pick samples from those livestock which are having either ongoing abortion or a recent abortion, and then we will take those samples to Entebbe, which is the National Animal Disease Diagnostics Epidemiological Center, to see whether we can test for Rift Valley fever. Actually, we will also test for other diseases like brucellosis, Q fever as well, which are also contributors for the abortions among livestock. And so the second objective for our work is to do a social sciences data collection. We intend to conduct knowledge assessment about Rift Valley fever surveillance systems and also on a potential vaccination program. We are very cognizant that in Uganda we haven't started the vaccination program, but we just want to get stakeholders' insights and views about a potential vaccination program if it was to come. And so we look forward to championing these two objectives. Actually, through support from the department, we have also been able to think of a third objective, which is aimed at increasing the knowledge of the One Health stakeholders about Rift Valley fever. And specifically want to support the health workers in various facilities to raise their suspicion index about Rift Valley fever, such that when a person comes to the outpatient department and is presenting with fever, is presenting with back pain, they should be able to think about Rift Valley fever as a potential cause for these fevers and that they could be seeing at OPD. And so that is in summary what we are planning to do for the 3 months of this project. Thank you.
Dr. Lawrence Mugisha, Associate Professor here in the College of Veterinary Medicine, Animal Resources and Biosecurity, Makerere University. I'm a veterinarian. I've practiced veterinarian as a vet for domestic animals. I'm also a wildlife veterinarian. I've worked in wildlife areas. I've also worked in other areas before I came to join Makerere once again as a lecturer and now as an associate professor. My areas of research interest are zoonotic diseases at wildlife, human and livestock interface, and Rift Valley fever is one of those diseases that is on my list of the pathogens that we are studying. Rift Valley fever is a neglected mosquito-borne zoonotic pathogen that has been around, especially in Africa, since the 1930s when it was first discovered and reported in Kenya. Since then, there have been several reports of Rift Valley fever. However, in most of other countries, there is limited surveillance or knowledge about what is going on with Rift Valley fever. And actually here in Uganda, it is just a few years back that we began to receive case reports of Rift Valley fever starting with outbreaks in humans. How did this one come to be known? Because Uganda has got an active surveillance system for the hemorrhagic viral pathogens, including Ebola, Marburg, and others. So during the same surveillance system, when they collect samples, they are tested for those viral hemorrhagic fevers, and they are absent, they go ahead and test those samples for now Crimean Congo hemorrhagic fever. Since 5 years ago, we have had sporadic reports of Rift Valley fever in this country. But more recently, the number of cases have been on the rise and on increasing, affecting both humans and domestic animals, especially livestock. So with that background, we identified the need of further studying this virus, and good enough, I happen to have a PhD student in the names of Abel Walekwa, who fortunately once again got an opportunity to be able to register with a PhD at Cambridge University in UK. And since then we have designed the Rift Valley fever studies going on in Isingiro District here in Uganda. And our main target was to first set up a surveillance system for the monitoring of livestock abortions, to establish the livestock abortions and what is causing those abortions, and also try to understand what people know about this Rift Valley fever. What kind of practices are going on in those livestock farmers to try to control Rift Valley fever, or they even don't know. So that there is a very big gap in terms of knowledge, and that's why this PhD student, I'm supporting this PhD student together with my co-supervisors in Cambridge, UK, in order to correct this information and provide more information of what is already known on Rift Valley fever, so that this country and our neighboring countries can come up with appropriate interventions and measures against this dangerous hemorrhagic disease transmitted by mosquitoes. Now, for it is maintained naturally between the vertebrates. These are animals, it could be wild animals, domestic animals, and the mosquito virus. Then even in the mosquito, it is propagated within the mosquitoes. Now the humans get infected once they are bitten by an infected mosquito with the virus, and different mosquitoes can bite us, and the virus is transmitted to humans. Once it is in humans, it can also be acquired through what we call occupational exposure. If an animal is infected and with the Rift Valley virus, and it is slaughtered, and you get into contact with those body fluids, blood and other fluids during the slaughter and so on, you can acquire the virus. Once you get infected with Rift Valley fever, you get a fever like any other like any other fever caused by malaria, and sometimes it is confused with malaria and other febrile illnesses. But once in a while, it gets complicated and it involves several different organisms, and it ends up getting what we call hemorrhagic syndrome. That's why it resembles diseases like Ebola, like Marburg. But in those ones, there are a few cases. But in animals, even if the cattle may not die, it leads to a lot of abortion. And in productivity, when animals abort, you have lost a lot of what? A lot of money. The health of those animals becomes very difficult to improve. But even in the young ones, it can also lead to death. So that's why this disease is very important. It is now affecting us. And I was surprised in the recent surveillance by the Ministry of Health, just in the last few months from May to date, they collected about 1,800 samples. But out of those samples, 49 of them were positive for Rift Valley fever. They were negative for all other hemorrhagic fevers, but they were positive. 49.8% were positive for Rift Valley fever. That means this virus is actually now circulating widely, and very soon we will have epidemics causing the disease everywhere in the biggest part of this population. It is even very surprised that even when they were doing this surveillance, some of the people had already died. They were collecting samples from cadavers of suspected hemorrhagic fevers. 38 samples were collected. When analyzed, they were negative of all others, but 4 of them were positive for Rift Valley fever. So what am I saying? That Rift Valley fever is already here in this country. Probably it has been circulating longer than we know, but because of improved surveillance for hemorrhagic fevers, we are now beginning to capture these cases. But again, even if we are capturing these cases, we are not raising an alarm. We are not sounding a bell to call upon for immediate interventions. So humans continue to suffer and die, animals continue to suffer, abort, and we lose money, we lose value.
Different stakeholders were briefed about the project. District officials appreciated the project.
Chairman Isingiro District, the district that borders with 2 countries, that is Tanzania and Rwanda specifically. Our district will host so many refugees. We have 2 settlement camps, that is Nachivari and Oruchinga, and they are oldest camps. And in all those camps, fortunately, they also have the animals. They also do activities of rearing animals and goats and others, and even my district as well. So Isingiro District, it is a district that is predominantly dominated by cattle keepers, and it is our main activity here as the district. So we are very happy to see that at least we have got some researchers, people who have come to mind about our farmers. You see, all along we have been having our farmers suffering from so many different diseases. I can call it outbreaks, because they can also come abruptly. For example, this issue of Rift Valley fever. The Rift Valley fever is a very challenging district, because farmers are suffering with it, where you find so many sometimes a pregnant cow delivers an anomaly, and this affects the farmers very well. So as the district, we have tried by all means to make sure that at least we see how we can help our farmers, but our hands are tied. We are handcuffed. We cannot help our farmers because we don't have a very good source of origin. Yes, we don't have a source of origin of this common disease that is affecting our cows, and this has affected our district as well, especially in as far as the economic activity is concerned. Our people should have been developing at a high speed, but unfortunately, after losing such young cows, and even it is even risky, the mother can die in doing so. So my appeal to the government, I'm appealing to the government if they can help us as the district and consider us very fast, give us a first priority as the district being at the border of Tanzania and Rwanda. They should give us a priority so that at least they bring vaccination and treat our animals. You know, we should treat the symptom when it is still early, instead of just waiting all people to get problems and they cry everywhere, and all cows when we lose all our cows and goats and sheep, so and even pigs, then it is when the government will wake up and say, now we need to help the people of Isingiro. That is unfortunate. I don't agree with that. If there can be any way, like Kenya and Tanzania, how they are helping their farmers, then let our government also come in. Good chance the Minister of Agriculture, State Minister of Agriculture and Animal Husbandry is from this area, is from Isingiro. He knows all those things. He knows that our farmers are suffering. So it's better to bring it on a board. They put it on the table and they make it a first priority. I want to thank the researchers, because all along as the district and even our farmers have been living in green world, so not knowing what is taking place in the country and even with their animals as well. But now they have managed to go down to the sub-counties. Those are so-called, we call them local governments. They have trained farmers themselves. They have sensitized people on the ground. So at least now people, they no longer live in shock of seeing something happening when they don't know, when they are not aware. Even if it is happening, they know at least these are the causes, they know the symptoms, because in sensitizing the community, in sensitizing the farmers, in sensitizing leaders, people are now knowing the causes and the symptoms of how this thing can your animal can get sick, and even how you can try by all means to treat your animal. Also, we already have information that when you get any issue, there are so-called contact people. Whom do you contact? You contact the veterinary officers at the sub-county level, you can contact the veterinary officer at the district level, and even other some specialized people that they give us their numbers. So understanding the problem, it is the genesis of getting a solution. If we don't understand, if we don't empower the community, then what you are doing, I think you cannot get the results. So I want to thank the researchers, people who have stayed in the district, in the local governments, who have managed to involve all the leaders. Now, as leaders, we have captured it. Whenever you go, whenever you meet the congregation, anywhere, You simply tell them, because we all have information now.
The DVO, Dr. Brohan Kasozi, appreciated the project.
My name is Willie Charles, retired veterinary officer in Isingiro. I'm here to report on about the things that have been occurring in Isingiro. The Isingiro National has over 35 sub-counties including town councils in Isingiro. With Isingiro, we have been having problems of abortion in cattle, sheep, and goats, which have been on for so long. These abortions were as a result of Bucera, and of recent we had abortion due to Rift Valley fever, which has been occurring in some parts of Isingiro, in areas of Uganda and areas of Rift Valley and Easy. We had cases of Rift Valley fever in 2016 where we lost animals and due to abortions that occurred, and there was an intervention by government through NADEC, which took samples from the Uganda Virus Research Institute, and we are informed about the dangers and the presence of this Rift Valley fever in livestock. Rift Valley fever has affected Isingiro because it's the core. Farming is our main activity. Mostly farmers are engaged in livestock keeping in Isingiro. They rear goats, sheep and cattle, and it has affected their income. But I want to thank for the intervention of government, and of late we have had the intervention of Dr. Abel Walike and Dr. Andrew Conlan, who have also come in to give us a hand. We have had sensitization of farmers. We started off with sensitization of farmers in all sub-counties of Isingiro, which has been ongoing. So we are now remaining taking swabs and blood samples for more sampling, and then going on to know how far the disease is. But the project seems to be concerned about Rift Valley fever and abortions in livestock. So we are very glad that we are going to have this program helping us create awareness to farmers. The farmers have been informed and they are aware of the disease, since we have had sensitization of farmers in all the sub-counties of Isingiro. I want to thank Mr. Abel Waleke and Dr. Andrew Conrad for their efforts they have done. They have created awareness and farmers are happy.
A call center for tracking and reporting livestock abortions was set up and managed by Mr. Charles Were, who was seconded by the DVO, and Abe Wilson Walekwa, the study coordinator. At the call center, the team kept receiving phone calls, SMS, and social media messages about livestock abortions in farms. The district veterinary staff were trained on the study protocol and tools. This was aimed at building the staff's capacity to continue with livestock abortion surveillance even after the project is completed. Data collection was done using Kobo Collect app on their Android smartphones. They were learning how to use tools and how to collect samples. The team members were given consumables and equipment before setting off to the field. Data collection was done in all sub-counties where livestock is kept. The project involved animal sample collection after recent livestock abortions. In this project, there was also sensitization of stakeholders about Rift Valley fever disease in their different communities. In this project, a training material about Rift Valley fever was developed. The community level stakeholders posed for a photo after a training at sub-county level. In this project, social science data on Rift Valley fever surveillance and potential vaccination program was also collected. This was done through key informant interviews and focus group discussions.
Marina Lowe, the Assistant District Health Officer in charge environmental health for Isingiro District. Livestock or animals is a big contributor to the income and generally the socio-economic status of people of Isingiro District. In that one, the people of Isingiro District are mainly farmers. In that, so from the livestock, first of all, when they sell milk, they get money to boost other aspects of life. When they sell the animals themselves, they get money that they can use for like the medical treatment, to take their children to school. In my opinion, I think even when we are doing this or with the livestock in place, we have not done enough, or we've not produced to capacity on what we are supposed to produce. Because of course we have challenges that come into play when we're doing some of the things, and as per now, I think the biggest is I would say the Rift Valley fever, because when it comes, you know, we have these abortions in the farms. So even an animal that is expectant, when it aborts, it means we're reducing on the numbers that we're supposed to have. Because if maybe an animal somebody has a farm with maybe 10 cows, and when 5 abort, it means I have reduced in the number by 5 animals. So at the end of the day, Rift Valley fever has been, to me, a big challenge to the farmers. And I think we need to do something in order to improve this, because to me this is a big loss to a farmer who has put in their best. And during the last minutes, when you're expecting that I'm going to add 2 or 3 animals in my farm, an animal aborts and you lose out on those ones. For me, I think the project and this project being implemented by Walekwa Abel Wilson, I think it has come in timely in that at least for the time he has been on field, our extension staff, the farmers have gotten the exact knowledge that before going to treat an animal, you're supposed to have a test, and they've also helped in the community sensitizations.
So nice to meet you today, and we are going to have some time to talk about Rift Valley fever surveillance, but also vaccination program within Isingiro, if any. So I'm happy to meet you today. My name is Abel Wilson Walekwa, and I'm happy to meet you.
Thank you, Abel.
What is your name?
My name is Sam Kwesiga.
Okay.
District Disease Surveillance Officer for Isingiro.
Okay. So we are going to shoot direct to Rift Valley fever surveillance. What do you know about Rift Valley fever, specifically within Isingiro?
First of all, Rift Valley fever is a zoonotic disease, meaning it is transmitted from animals to humans. And in Isingiro, we had quite a number of outbreaks of Rift Valley fever. Right away, my first experience of managing it was in 2018, when we had an outbreak of Rift Valley fever disease in Isingiro.
Focus group discussions were then conducted within the community. The samples were then shipped to National Animal Disease Diagnostics and Epidemiology Center. From time to time, there was stakeholders' review of the project progress on how to sustain the program by the field team.
First of all, I want to thank you so much for having me. I want to share with everyone that our study in Isingiro has gone on very well. We had anticipated that we would finish around July 2023, but we have been able to finish actually within June, which is a great time that we have finished our project on time. And we want to give great thanks to the partners that we have been working with, specifically the Eco Health Conservation Research Group, which is headed by Professor Lawrence Mugisha at Makerere University. They have been very supportive and guiding us on how to run this project in the field. We're also grateful to Isingiro District local government, because all the technical staff that we used in the project, like in data collection, like in the investigations, like in sample collection, were actually staffs of Isingiro District local government, and so we are very grateful for their commitment in the project, but also support in the project. We are also very grateful for the district leadership, because we had a WhatsApp group, a social media group, where we are getting technical guidance from the top leadership of the district, and this kept us on top of the game. It helped us to continue implementing our work, but also navigate field work whenever we found any challenges. So regarding our work, we actually were able to achieve all the 3 objectives, and we have been able to do that within 3 months. So the first objective, we were able to actually pick 329 blood samples from cattle, goats, and sheep. And so we have shipped them to NADEC for lab analysis, and actually we have finalized the lab analysis. We have the results, but we have been guided by the Ministry of Agriculture, Animal Industry and Fisheries officials that as part of the policy, since this is a research project, we will come and disseminate the results officially to the ministry, but also to Isingiro District once we are ready. And so we are going to do analysis, and then we will come back and disseminate the findings and to the different stakeholders. Our second objective was about the knowledge assessment. We actually found that relatively different stakeholders had knowledge about Rift Valley fever disease itself, but they didn't quite know much about the surveillance mechanisms, but also the surveillance systems in place. They also didn't have a good distinction between Rift Valley fever therapeutics and Rift Valley fever vaccine. And so that means that there is a lot more that we need to do in terms of sensitizing, in terms of training them, in terms of teaching them about Rift Valley fever control mechanisms, but also surveillance efforts in the district for such zoonotic diseases. What came out very strongly is that there is no local name for Rift Valley fever disease, and so we kept describing the disease to the local stakeholders, specifically the farmers, so they could not ever know it. But when we describe it and we describe how it is spread, and we describe the signs and symptoms, say, oh yeah, we normally see it in our farms, we normally see abortions in our farms. And so we think that as a country in Uganda, there is need to invest in getting a name for Rift Valley fever, such that farmers and other stakeholders can quickly know, such that when you just mention this name, they know that you're referring to this particular disease. We were able to get different insights from the policymakers about potential vaccination program, but also the farmers. There was a lot of interest from the farmers about rolling out Rift Valley fever vaccination program, but the policymakers seemed to still need more evidence about the distribution of the current distribution of RVF before they could roll out the vaccination program. Actually, they suggested that there is need for evidence-based roll out of these vaccines here. They were wondering what current viruses are circulating in the country. They were wondering which areas are mostly affected. If we are to vaccinate, should we vaccinate which geographical areas? And so we think with more research and with more evidence generated, the government of Uganda may think about having a vaccination program for Rift Valley fever. Our last objective was to intervene and raise suspicion among health workers in Isingiro District. We were able to do this among 450 health workers, both clinical and non-clinical health workers in Isingiro. And so we have been able to train them about RVF spread and management. We have been able to intervene in 6 health facilities out of 18 health facilities. So literally, it means that we went in fewer places than actually we would do, but that we had shortage in resources, and so we would recommend that more scholars should intervene, or even the district officials could intervene more in raising the awareness about Rift Valley fever. The good thing that we did is that we have designed a training manual which the ministry's officials have accepted and agreed to roll out and use. And so we have left the manual behind with the district officials, and we hope they will continue using this manual in intervening, but also in training their staffs about Rift Valley fever. Specifically, we see an opportunity in the continuous professional development, which are called also continuous medical education, whereby districts are supposed to have in-service training, which they should use to build capacity in their staffs. And so we have discussed with the district officials, and they are already willing to have Rift Valley fever among the diseases that they use, that they will be teaching or training about for the in-service training. So generally, we shall be doing further analysis of our Rift Valley fever that we have collected, and so we'll keep you updated on how the results have unfolded on various objectives, and we will keep you updated on what comes out. And so we thank you so much for the support.